Well done, Jim, and great examples of a holistic and I suppose a human approach to many of the challenging and issues in terms of the area of the Northeast Inner City. And thanks for your comments related to the Assembly, and well done to you and your work in the previous Assembly last year. Just before I go to the floor, which we will do again straight away for a random Q&A, I just want to call on Carl Duquet. Carl is one of our lived experience people who shared experiences with us before. And just if Carl wants to add anything to the whole issue of prevention, and particularly with youth people that he would work with. Carl, floor is yours.
Yes, thanks, Paul. It was great seeing the prevention all day, and thanks to the panelists as well. And I was thinking of my own experience of like preventions I would have had. It's great to see how far prevention has come since I was 16, and I suppose my mother brought me to a GP, and the intervention what was made, that GP put me on a methadone program at 16 years of age, which was shocking, you know. And I remember even going back to that GP in recovery and challenging her, and she came at me with legislation from like Holland in the 1970s, and to me it's proven that how far we have to reach with this, and how many people we have to kind of get on board with. And when I was thinking of like when all the projects were up there talking, I couldn't stop thinking about early school leavers and people in isolation that we haven't spoken about, you know, and looking at, I suppose, the interventions and the prevention out there on the ground at the moment, with youth work, community-based groups out there, I suppose, reaching these people, and even the prevention of, like, you know, when one of the citizens asked for the outcomes, you know, I was thinking, I have outcomes with my project where I've put people through college, and they're now youth workers alongside me, which is great. But some of my best outcomes, I suppose, was with young people who are probably still doing bad things by selling drugs and all, but they're a stay-at-home father. They bring their kids to school, you know, and to reach that level of an intervention with some people, you can't explain that to a department, you know. You can't quantify that, and you can't say, well, this is what I aim to do. But that's some of my best outcomes, you know. So, yeah, I suppose I was just looking at, like, to talk a little bit about the work being done on the ground out there, and, like, I suppose to highlight the fact that we need to be looking at the people in isolation and the early school leavers that we haven't talked about out there as well, you know. So,
thank you. Thank you, Carl. And you make a very good point about the people that we don't know, or we haven't seen, or we haven't come through the treatment as well, or haven't been through prevention. So thanks very much. So again, I'm going to go across the tables in a more random fashion. So please just put up your hand. We're going straight into Q&A, and this one again. Yeah, we're going straight into Q&A again. So just put up your hand. It's not restricted to one per table. Please just put up your hand, and we'll come to you. We've a roaming mic. And okay, table one, please.
Hi, thank you. Just a question for Jim. Jim, this morning we heard one of the speakers talking about primary, secondary and tertiary interventions for prevention. A lot of what you're talking about, to my hearing, is kind of tertiary interventions, and I was wondering what's been done to develop community supports to direct people away from the risks in the first place, such as social clubs or sports clubs and all that kind of stuff, and is that part of the programme?
And just before I call you in, Jim, I'm just going to take another one from the floor so we can keep a mix across the panel. Yeah, Zin, and table 12, I think it is.
Thank you. I have a question to Fiona. As we talked about the qualified condition to enter the CE, so they need either the receipt of the job seeker payments or the family support payments or some reference. But if someone becomes homeless and they don't have an address, so they cannot have a bank card, so they cannot receive any benefit payments, and could you please actually clarify that? How can the homeless people receive the payments of benefits? And if in this case, if no one is referring them either, and they don't have receipt of the benefit payment, then how can they qualify the
Thank you, Zin.
Thank you.
Okay, I'm actually going to take one more question as well, because I want to keep the panel for a few minutes. One more question from the floor, if we have one. Yep, please.
Hiya, this is Director Tandy. Are you getting any? Have you submitted like your solutions to the government, and have they? Do you get any funding or anything? Or
Okay.
I'm just wondering.
Okay, yeah.
No, okay, I'll call them in now, don't worry. Okay, so first one was the Jim, in terms of the community supports, diverting people away from the risk in the first place, what exists.
Yeah, thanks, Chair, and great question from Table 1. So, as I mentioned in my opening remarks, we have 6 subgroups across the NIC Project Implementation Board. The second group focuses on family well-being and the youth and family. So, we not only do we have after-school services, but we've also got what we call HAY Youth Division projects. We have a strategy around after-school care, youth clubs. So there is a lot of focus, not only from the PIB, but also through other inter-government agencies to provide a safe space for kids and young adults in the NIC area to have after-school and to have services during the evening time to keep them occupied. The budget for the entire programme, we currently have a budget of 7.2 million.
Thanks,
Yep.
Jim. Fiona, just in terms of access to CE schemes, if you're homeless or not able to meet certain criteria, what flexibility is there?
Well,
How
I
do you
mean,
do it?
well, in terms of the question was asked about how people can access their payments. They can access their payments through the post office network, and we actually have homeless sections actually within the department, and they look after people who are currently homeless. In relation to qualifying for CE, I mean, if you are referred through one of the various rehabilitation services and agencies, or referred through the Irish Prison Services and some of those agencies, there's no waiting period, and you don't have to be on a qualifying payment to access the CE schemes. And generally speaking, if you're referred from an agency, there's no waiting period, so you can access CE immediately. It's seen as a progression from our perspective. Yeah.
Okay, Fiona, thanks. And just, sorry, the next question, which I know was posed to Andy, but I'm also going to ask Father Peter if he wants to make some comments, but it was generally the solutions that you both have seen can work, have those being presented to the political process. And I think I know the answer, but you might just relate, Andy, first.
Well, look, first of all, we are struggling for funding. Well, it's been recognised that we're underfunded and under-resourced, and we've been told that will be rectified. But I think it's more about what ISCA is and how it works, and it's a process, and it's independent for a reason. I think if people remember back to the Ryan report in 2009, that was the investigation into the institutional abuse. One of the findings was that the guards, TUSLA, or whatever they were called, and all the services couldn't manage the internal mechanisms of listening to people. So it had to be so one of the recommendations, they had an independent advocacy service, and that's not an organisation called EPIC now. So it's independent of the state, funded by the state, there to critically analyse what's going on from this perspective of lived and living experience. Now ISCA is independent, and it's the only independent organisation out there. But we would just be worried about protecting that process. Like, our process is that we do outreach, we do groups, we do research, we set up structures, and it's all based around living experience. People come in, we start out with the issues, and we build it around them. So everything is from the ground up. And at times we think, look, there's good, well-meaning projects that are being developed by the state or the services, but they're internal mechanisms. And we know from people who use drugs, they have poor experience and poor outcomes in these services, in these structures. So the ability for them to have a voice within that is problematic. So protecting the independence and also the process is very important, because what we do find is it can be very, very challenging that we do raise stuff, and at times, we feel like the levels of participation are low, and maybe we might get a seat at the table, but we're not sure if much of it's being listened to. Like, look, there's great programs out there. The NEIC is an example, and we've seen other ones, but again, we have to be realistic about the outcomes. The NEIC has done fantastic work and there's been really good initiatives, but has it really improved the outcomes, and has it increased the participation of those most marginalised in that community? We have to be critical and say not yet, although there has been successes. And I'd say one of the things we would be working with, and again, we work well with the department, we work with the DPU, we work with the HSE. Like, we wouldn't be involved in the NEIC, for example, even though we're based in the north in our city, and we are a national organisation, and their very particular way in which we operate is unique. It's a community development process. Now, there is state-run or state-designed service user groups which are in there, and we would say there needs to be that little bit of an independence, and just go back to say, like some of the, and it's not about having a go at people or attacking, because I think there's a little bit of, there's challenging times in these spaces, because there is a lot of polarisation, and I would say we need to have ownership collectively, whether that services the state, and say, look, things aren't working and we need to cooperate more, because the people need it, the people are looking for it. And I would just go back to, like, if you think back to the 90s when we had the starting up of the drug task force, there was a very simple but really effective message from them. The community had realised through the drug marches and the vigilantism that they couldn't resolve the problem on their own. The state, which had realised this problem had got out of control and was seeping out of these communities, realised they couldn't do it without the input of these people. So the whole task force was set up on a collaboration approach.
Okay,
the issues are raised within the community,
Andy,
and then solved by all the stakeholders. But we need to go back to some of that
Andy,
now.
I'm trying to be fair to all panellists. Father Peter, can you make some comments generally, please?
Yeah, I'm very frustrated. I don't think there is a political will to address this drug issue. To me, I've often said it, I think the drug issue is a far greater threat to the stability of this state than the IRA ever were. In deprived areas, the intimidation is immense. Drug debts are rife. Drug dealers are smashing up homes, are threatening people's children. They're destroying community, because in a community like that, you don't want to know your neighbours. You don't want to get to know your neighbours. So I just find it very, very frustrating. We have lots of people on a waiting list for drug treatment. As I say, we have 5 treatment centres, but they're waiting 4 and 5 months. And when somebody does come to the point where they want to go into treatment, you only have a small window of opportunity to get them in. And if they're on the thing for 4 or 5 months, many of them will drop out. They'll get despondent, they'll get fed up. Many parts of the country have no treatment services whatsoever. And then when you come out of treatment, you come out very often back into the same neighbourhood that you are living in, where drug use and your friends exist. I just find it extremely frustrating working with drug users when the services are so. 10 beds for the North Inner City, 10 stabilisation beds for the whole North Inner City. Most drug users today are on polydrug use, particularly tablets. Tablets are the hardest and the most dangerous drugs to come off. And for the North Inner City, there are 10 beds. I think that is absolutely disgraceful. It's great there are 10, there should be 100 if we are seriously going to make a dent in the drug use.
Thank you, Father Peter. Jim, do you want to come back in on any of that?
Yeah, just maybe to give it a little balance. Like recently, we met within the NEIC, the network of principals. We met them in Croke Park. So you got 10 primary schools and 6 secondary schools, and they, from a youth perspective, going back to Table 1's question in terms of what's been doing for the youth, they have a very positive outlook in terms of the NIC. And I take Andy's point that there a lot of good work has been done, but there's a hell of a lot of work to be doing. That's why we're going through this review, Andy, to see those exact points that you've raised. Where can we make? Where have we seen the challenges? Make an assessment. Has it been impactful? Yes, no, and then how do we realign that? But there is, in the northeast inner city, which I can only speak of, there is a very positive story in terms of the youth, people having not only good leadership results, but just in general the educational system that supports them now. So there are green shoots. I think those of you who are familiar with the northeast inner city, you'll be aware that not only from a capital investment from an infrastructure perspective and the environment, but also in our schools. And I think that's ultimately that education will certainly help this issue.
Well, thanks very much. And I think it is important that the project that Jim chairs has.
Can I just say one quick thing?
Sorry, one chair. Okay,
sure.
one chair. I think Jim's point is there is a whole wrap of a whole set of state services working together, which, that's what we would all like to see across the board. Sorry, Andy.
It's just quickly now, because it's just to say, because it's not just about the NEIC, like again, that they do good work, but the NEIC as a model in and of itself isn't set up to look at the underlying causes. So even like the HSE, it's a service delivery model. They can't do it on their own. The DPU can't do it on their own. If we're going to address the underlying cause and have the proper prevention, it does need that cross-departmental support,
Okay. Okay, going to go back to the floor, please. Anybody with question? Yeah, yes, table 9, sorry. Again, I'll take 2 or 3, so if anybody wants to just put up your hand ahead, table
Just,
3.
I'd like to ask Father Peter McVerry, I remember, it just came to my mind there, the Gregory deal long, long ago, and I was just wondering, you know, how with the benefit of hindsight, how you feel about it, and would there be any lessons that could be learned from it for today's problem?
Just 1 second, Father Peter, and we'll come back to you on that one. So, good question. Lessons, the Gregory deal, as it was referred to. Had we got table 2?
Just to ask Peter, how much money would it take you to run a really efficient drug rehabilitation system in your empire?
So, actually, Father Peter, these both are for you. I'm going to take one more question, if anybody's ready with a question. Yeah, sure. And then
it's just more maybe of an observation. We spoke earlier, or we listened earlier to a lady from the Department of Education, Celeste, and up until 16, children will go to school. So we jump forward to the age of 18, and this is when people that maybe have gone through the services can now avail of community employment. We're just missing from 16 to 18, those 2 years, and we haven't really delved too much into data that would suggest, you know, what age drug addiction starts, but we're fairly sure it doesn't start the minute you turn 18. So looking back, you know, it's sort of at the age of 15, and like there's a couple of years there where we're not really thinking about that. And if anyone has any comments, that'd be great, but just an observation really, is there anything being done for these young people? Because neither meat nor milk. They don't have to go to school, but they're not adults. Do you know?
No,
Thank
very
you.
good, very good point. And
Thank
lots
you.
of services, there is that gap, health services in particular. Anybody else there? No? Okay, we'll just pose those 3. Father Peter, the whole issue around the Gregory deal, learnings, and also how much money
Yeah, the
do you want?
Tony Gregory deal was unique and has never been repeated again. Tony Gregory had the balance of power. His vote was would determine. And Tony Gregory was refused admission to the Dáil after he was elected because he wouldn't wear a tie. He said, my constituents don't wear a tie, I'm not going to wear a tie. And then one day came and they needed his vote. So they let him in without a tie. And that broke, so he was in. So anyway, it was a unique situation. One thing Tony Gregory did call for was that CAB, you're familiar with CAB, Criminal Assets Bureau, they go after the big drug dealers. But Tony Gregory said, we need localised cabs to go after the street drug dealers, because these young people in deprived areas, like the inner city or Ballymun, they see these 15, 16 and 17-year-olds who are selling drugs, making a lot of money, wearing a lot of jewellery, driving flash cars. This becomes a role model. And his emphasis was, look, let CAB go after them and show these youngsters coming up that drug dealing doesn't pay. And they've never really done that. As far as I know, they haven't done that. But every area should have a CAB going after the street drug dealers who are making an awful lot of money. How much would it cost? Drug treatment is very expensive. Our drug detox centre costs about $750,000 a year. We'd have maybe 70 or 80 people would go through that per year, so it's very expensive. But you need staff there looking at, you need counsellors, you need a doctor, you need nurses. It's very expensive, but we have to pay the price. It's very expensive not paying that. It's very expensive in terms of crime, people being robbed, people's houses being burgled. It's very expensive in terms of the criminal justice system, because if people commit crimes under the influence of drugs, then of course the criminal justice system comes into play. As I say, 70% of those who go to prison have an addiction, and they're there because of their addiction. So it's very expensive not paying for drug treatment services.
Fiona, thanks, Father Peter. Fiona, can I just ask you this issue of a gap between 16 and is there a gap as Joanne outlined?
I can take that one, yeah. Just there is the Youth Reach programme that the Department of Children, Equality, Disability, Integration and Youth, I had to write it down because we call them DESID in official services circles. They have responsibility for, and they have programmes for early school leavers, and the staff, my team in the Employment Services engage very closely with Youth Reach to try and see what what we can do when people who are leaving that youth reach programme at age 18. We also have commenced actually engage with them in relation to CE and whether we could see what we could do in there in terms of offering some CE places. We do have young people on CE, though I would say that apart from people who say have very significant barriers to employment, such as people who are in recovery or ex-offenders, CE isn't really something that we would be prioritising for a young person. We'd much prefer a young person to go into education and training and that. So it's really about striking a balance. But youth reach is there for that kind of in-between gap.
Okay, can I just again catch somebody on the hop? Johanna Ivers again, who's from the North Inner City. And plenty of experience. Just in terms of what your experience, Johanna, was about, what's working, what you're seeing from the North Inner City project, but what your experience has been and what the needs are, which is representative of an area of high social deprivation.
Paul, this is getting personal.
You can stand up now. You can stand up. Stand up, and then I can see how happy.
I suppose when we look at the North East Inner City Initiative, the outcomes are not there because it's quite a new initiative. What I would say is in my last address to the Assembly, I would have asked for political will. I would have asked for bringing along the people it affects the most, and I would have asked for an evidence base. And I think the North East Inner City Initiative, while it's not perfect and ticking all the boxes, that there's a real micro example of that. And lots of people talked about political will, and I've always talked about political will. And again, that's an example of where we've had political will, okay, on a small micro level. We've had investment, we've had the people around the table that need to be. I know there's other people that's been kept out, that's a different issue. But again, it does represent a micro example. Given that it's now, what time is it? I assume this is the last question.
No, we might get one more. We might catch you on the hop again, Johanna. Okay. Okay. Anybody else from the floor? Yeah, it's Colin first of all, and then we go to you.
Good afternoon, and thank you for your time. Our remit is to give recommendations how to tackle illicit drug use. What one recommendation would you give?
And you're putting that to the panel? One recommendation to each. Okay, I'll come back to that in a second. Colin. Sorry.
There's been a drug policy in this country for many years, what they say, 2017 onwards. How, in your opinion, after all the recommendations are going and everything, can we assert leverage on the government to have them accountable for their actions going forwards?
Okay, and I think they're kind of across the board. Can I ask each of the panelists on the first one, starting with yourself, Father Peter, but again in succinct for each, so I can get everybody in. What one recommendation would you ask us?
I thought you'd let me go last. What one recommendation? Gosh, it's. I don't think there is one recommendation. This is a multi-dimensional problem. I think we need to invest in services much more adequately than we are doing at the moment. You know, there was, I can't remember when, but it's about 15 years ago, one of the drug strategies suggested, and maybe this would be my recommendation, it said that nobody should wait more than 4 weeks for drug treatment after being assessed. Now, that's a joke at the moment. Many, 15 years later, that just doesn't happen. It happens in some areas because there is no drug treatment available, so you're not waiting more than 4 weeks. But I would say that would be we should be aiming for a situation where nobody who is assessed for drug treatment would be waiting more than 4 weeks to access drug treatment.
Thanks.
The other question was...
And we come back in a second. So, well, actually, while you're here, I'll ask you really quickly again, but just how, out of this process, can government be held to stronger accountability, considering 2017 a policy in place and some things haven't happened?
Well, if you all tied yourself to the railings of Dáil Éireann, maybe something would change. But short of that, I'm not sure. To be honest, you know, the big problem is deprived areas. That's where most drug misuse and the problem drug use occurs. Most politicians don't live in those areas. They live in nice houses in nice areas. They're distanced from the reality of the consequences of drug misuse. And so it's very difficult to get them to, I mean, I think they should all go and live in the North Inner City for a month.
Okay.
But so it's I don't know how you get them to.
Thanks, Father Peter. And Andy, again, briefly on both, one big recommendation and, you know, stronger accountability.
Thanks, Paul. Yeah, look, I'll pick just one of our 7, and I think you have to implement the raft of them for them to work, but the one we would pick is to implement the social determinants approach, which can address inequalities, promote broader well-being and improve quality of life. That's the underlying causes, and I would just say that process has to be informed by a strong ground-up process, which is heavily designed, delivered and evaluated by people who use drugs, families and the communities that are most effective. And in regards to holding the government to account, I'd go back to the 3 themes I said. I would think you should have underpinning themes that overarch everything. 3 of them we've said would be keeping people alive, promoting broader well-being and improving quality of life. And again, we have to be critical as a collective, as a community, as a society, not like again attacking or finding anyone at fault, but collectively we don't achieve those 3 for the majority of people we're talking about since the last 30 years. So again, the NEIC model, it's only 6 years in existence. In 5 years, 10 years, every 5 years, let's have a committee that centrally, let's put together a cross-departmental committee that oversees this implementation, and every 5 years let them go back and see, have we met those 3 themes in 8 communities that we're talking about? And if we haven't, we need to reevaluate why. Because I'll say a lot of the time when things aren't working, it's because we're not listening to the people who are the most impacted.
Thanks, Andy. Fiona, again, briefly, feel free to comment on both or either, but certainly, what one thing would you be asking from your perspective of the Assembly?
Well, I suppose to echo what Father Reid said, is timely access to services, you know, within a reasonable time frame, and also to ensure that that cross-government, cross-organisational working and cooperation is kind of embedded, and you know, it's just done systematically within the system.
Okay. And
I'm not going to make any comment on holding government to account. I'm going to step back from that one.
Okay. But I can do it now. It's great. Yeah. Jim.
Thanks, Chair. What I see in the NIC is that, and you've seen it as well, there's a multitude of departments involved in this particular challenge. There's NGOs, there's different community representation groups. It's a complex area. For the legislator who will give your recommendations, it's up to the Attorney General, the politicians to define the policy. For me, it's having that strong, the recommendation will be, to answer that question, is having strong local representation, including people with lived experience. And I think that lived experience bit might be missing. Father Peter referenced it there. Politicians, most of them don't live in those deprived and socioeconomic deprived areas. It's people with lived experience need to be at that table to inform the policy. That's one recommendation I would suggest. In terms of holding people to account, it's about delivering results. When you look at the programme for governments, which that's where when we go to vote, I'm assuming everybody here votes on that programme for government, or their ambitions, they should be tangible, a target set. For example, if Father Peter's saying we need 100 rehabilitation beds, they're measured on that. So it has to be tangible measurements for the government rather than broad philosophy and concepts. I think that's that's the only way we'll hold people accountable.
And certainly having legislation in the drawer since 2017, you know, and not progressing, and no sign of it emerging in the next foreseeable future. It's shocking. I'll get off my horse. Sorry, I'm conscious now we've eaten into your time. Can I really thank the panellists that we have here for the last session today? It's always a tough session at the end, but we've had some really great insights, and thanks to you all indeed.